Erectile dysfunction. When the penis does not function properly. Erectile dysfunction, or impotence, is a very common phenomenon that can have both physical and psychological causes. Today, there are many effective remedies for this condition, yet those who suffer from this condition often prefer not to report the problem. But everybody knows it deeply affects the quality of life. Hello and welcome back to Med for Care. Today, we will explore together the causes and therapies for erectile dysfunction. Erectile dysfunction or impotence problem. What is it? We speak of an erection problem, or erectile dysfunction, when we refer to a condition in which a man has difficulty achieving or maintaining an erection sufficient for satisfactory sexual activity. There are many causes that can cause it, both physical and psychological. Often, these two aspects coexist. How frequent is erection difficulty? Erectile dysfunction is a very common condition and can affect men of all ages, although it is more common in men over 40. It is estimated to be around 13% of men in developed countries, with wide variation between countries and age groups. There are several risk factors that could cause dysfunction, such as diabetes, hypertension, heart disease, but also psychological factors, such as anxiety and depression, or wrong habits, such as smoking and unbalanced diet. The cultural factor should also not be underestimated. Male impotence is in fact often underestimated and underdiagnosed, usually out of shame and fear of the judgment of others. It is important to discuss this with a doctor. Today there are many treatments available, and openly discussing one's health condition, including sexual health, is a mature and considered approach which helps to improve one's quality of life. Erectile dysfunction. What are the causes? The causes of erectile dysfunction can be different. Let us try to clear our minds a little, starting with the physical causes. Physical causes. The physical reason for erectile dysfunction is a reduction in the amount of blood entering the penis. This can occur due to vascular problems or due to external physical reasons, which mechanically obstruct the entry of blood into the corpora cavernosa of the penis. The most common physical causes include heart or vascular diseases, which can reduce blood circulation to the penis. Diabetes can cause damage to nerves and blood vessels, which are important for erectile function. In addition, high blood sugar levels can cause reduced sensitivity and sexual response. Some prostate diseases, such as benign prostatic hyperplasia, lead to enlargement of the prostate itself, thus obstructing the flow of blood inside the penis. Trauma, such as trauma to the penis or pelvic area, a penile fracture or spinal injury. The side effects of certain drugs, such as antidepressants, which can lead to erectile deficit. What about the psychological aspects? Psychological causes. In addition to physical causes, psychological factors must be considered. Let us look at them together. A first aspect to consider is performance anxiety, as it can generate tension and stress, which negatively affect the ability to achieve and maintain an erection. Stress also affects the normal functioning of the nervous system, and anxiety can interfere with sexual desire and libido. Depression can also cause a reduction in sexual desire and libido, making it difficult to achieve or maintain an erection. In addition, some drugs used to treat depression can have erectile dysfunction as a side effect. Finally, it is necessary to consider any relational problems with the partner, such as lack of communication or intimacy, which could inhibit sexual performance causing impotence. Let's now find out how erectile dysfunction is diagnosed. Diagnosis of erectile dysfunction. For a correct diagnosis of erectile dysfunction, a visit with an andrologist will be necessary. The first phase of the examination will consist of a detailed anamnesis, during which the doctor will try to gather as much information as possible about the erection deficit, its occurrence and frequency, and all related aspects, such as the patient's medical history. This is followed by an objective examination, which focuses on the male genitals, looking for any signs of disease. It may include a rectal exploration to rule out prostatic hypertrophy. Instrumental examinations. After the objective examination, we move on to instrumental examinations, which can be different depending on the situation. Usually, the most frequently performed procedures include a urine test, which is used to rule out kidney or urinary problems. Blood tests may also be required to check levels of testosterone and other hormones, or to rule out the presence of diseases such as diabetes or atherosclerosis. Finally, an erection response test may be required, during which the patient must use a specific device to help him or her achieve and maintain an erection. In some cases, the doctor may also recommend undergoing instrumental examinations, such as Penile Doppler or dynamic governosometry, to assess erectile function. Once the diagnosis has been made, the andrologist doctor will be able to prescribe the correct treatment for erectile dysfunction. But what treatments exist? Therapies for erectile dysfunction. Let us now see together which types of therapy can be used, their benefits and contraindications. Pharmacological therapy. Pharmacological therapy involves the use of drugs to improve erectile function. Among the most widely used are PDE5, phosphodiesterase 5 inhibitors, which work by increasing blood flow to the penis, a prerequisite for achieving and maintaining an erection. PDE5 inhibitors include sildenafil or Viagra, tadalafil or Cialis, vardenafil or Levitra, avanafil or Stendra. These drugs must be taken orally before planned sexual activity and only work in the presence of sexual stimulation. They act by inhibiting the action of the PDE5 enzyme and help maintain high levels of cGMP, thereby increasing blood flow to the penis and facilitating erection. However, it is important to note that these drugs can have side effects such as headaches, nausea, dizziness and visual disturbances. They are also not recommended for people with certain medical conditions, such as cardiovascular or blood pressure problems. Another drug used to combat erectile dysfunction is aprostatol. It can be taken either topically or intraurethral and works by releasing nitric oxide, a natural body chemical that increases blood flow to the penis, promoting an erection. Alprostadol in the form of an intracavernous injection is one of the most effective treatments for impotence and is used when the patient does not respond to oral therapies, as well as in the form of a transdermal patch called Mu's medicated urethral system for erection. Testosterone therapy for erectile dysfunction. If the problem is caused by low testosterone levels, a therapy that administers it may be suggested. Again, testosterone can be administered either orally, transdermally, by injection or subcutaneously. Before starting this therapy, a blood test is performed to measure testosterone levels. Furthermore, it is not recommended for patients with prostate cancer, a history of prostate cancer or a risk of developing it. Testosterone therapy may have side effects, such as weight gain or water retention, acne and reduced sperm count. These factors make this a very specific treatment to be used under strict medical supervision and only in cases where it is really indicated. In addition to physical causes, there may be psychological problems that cause impotence. What therapies are possible in this case? Psychological therapy for erectile dysfunction. Psychological therapy can help treat the psychological causes of the condition and can be carried out individually or with a partner. Different types of therapy may be recommended, such as cognitive behavioral therapy, which helps to identify and modify negative thoughts and behavior that can lead to powerlessness. Relational therapy can also help improve communication and understanding between patient and partner, and thus solve any relationship problems, which often contribute to erectile dysfunction. Finally, sex therapy may be recommended, which can teach techniques to increase sexual response and improve erectile function. In some cases, psychological therapy can be used in combination with drug therapy to achieve greater results. In any case, pharmacological and psychological therapy should be combined with various lifestyle changes. Let's not underestimate the importance of small daily adjustments. Changes in lifestyle. Here are some tips for a healthier lifestyle. Regular exercise is recommended to improve blood circulation, which is crucial for erectile function. It may be helpful to stop smoking and limit alcohol, as both have a negative impact on sexual function. Losing weight can also be an important factor. In fact, obesity can cause erection problems. It is also necessary to favor a healthy diet rich in fruit, vegetables and whole grains. It should also be remembered that learning to manage stress can be useful with the help of meditation and relaxation techniques. Finally, it may be important to strengthen the relationship with one's partner. This is often the key to improving individual sexual function. Non-pharmacological supplements for the treatment of erectile dysfunction. Recently, some supplements have been proposed as possible treatments for erectile dysfunction, but there is still no solid scientific basis to support their efficacy. These include herbal supplements such as ginkgo biloba, tribulus terrestris and epidemium. Arginine, an amino acid that helps improve blood flow, and DHEA, a hormone produced by the adrenal glands, also appear to be useful in cases of impotence. Vacuum devices. Another type of treatment is possible with vacuum devices. Vacuum devices are a non-invasive treatment option for male impotence. They work by creating a vacuum around the penis, which helps to increase blood flow and promote an erection. In this treatment, the penis is inserted into a cylinder, and a manual or electric pump is used to create a vacuum. A rubber ring is then used to secure the penis and maintain the erection. The device can be used for 30 minutes a day for a period of 4 to 6 weeks. Vacuum devices can be used alone or in combination with other therapies. They are a safe and well-tolerated option for many men with impotence. However, they can cause some side effects such as bruising, pain and pressure problems. Penile prosthesis for the treatment of erectile dysfunction. When the patient appears to be unresponsive to other therapies, the specialist may consider the use of prosthesis. There are two types of prosthesis: inflatable and semi-rigid penile prosthesis. Inflatable penile prostheses consist of two inflatable cylinders that are inserted inside the penis and a pump that is placed in the scrotum. To achieve an erection, the patient uses the pump to inflate the cylinders, which then cause an erection. Semi-rigid penile prostheses, on the other hand, consist of two rigid bars that are inserted inside the penis and can be bent at will to hide or show the erect penis. Both types of prosthesis can be removed or replaced if necessary. Penile prostheses, like any surgery, involve risks and side effects, such as infection, pain, bruising and thrombosis. We have now come to the end of today's video. We hope you enjoyed it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new MED4 Care video comes out. See you soon.